Hey, so I just had a very interesting conversation with my friend. I was sharing with her the guidelines that has been changed for blood pressure and the normal ranges. So she didn't know that less than 120 over 80 is normal, right? And what really triggered me to record this video, which I'll explain more, she's been working with a practitioner of some sort. She says she's not a dietitian, but she purely focused on managing blood pressure. And she gave her a sheet, and she recalled the sheet having like 120 over 80, but then there was some wording after it that said keep it under that. So she was like, this 120 over 80 is ingrained in her head. So that's the goal, right? And it's been commonly known for so long, 120 over 80 golden numbers, right, for blood pressure. However, science have proven that those are no longer safe ranges, so it needs to be under that. But from a health literacy perspective and lens, I'm also thinking about the less than symbol. People see that 120 over 80. So it's psychologically ingrained in our minds that that's a good blood pressure. And I feel like there is a gap in communicating what normal blood pressure ranges are. Because even with the less than symbol, which a lot of people don't know what that means. Let's be honest. A lot of people don't know what that means. Or even with the term less than spelled out, I still feel like that visual of 120 over 80 is going to be seen as a safe or therapeutic range. Especially since this is what's been understood for so many years. So, her hearing what I told her about these guidelines, the guidelines changing 120 over 80 is not normal. Now she said, I'm going to make sure I make an aim to be under that so I'm not, teetering the fence, right? So I say that to say that I think there needs to be an adjustment on how normal blood pressure is communicated via written materials. Because when people see 120 over 80, regardless of the indicating symbols, they still see that 120 over 80. And I feel like everything else is ignored. So if less than 120 over 80 is what we want to communicate, then actually write out the numbers that are less than 120 over 80. 119 over 79. Now, I know blood pressure, especially manually, is in increments of 2. So there needs to be a better way to communicate that, because I feel like the 120 over 80, seeing that number or those numbers can be misleading for some people, especially people with low literacy in general, don't know what the symbols mean. Not even interpreting less than, the term less than correctly. So many different things. So that's a suggestion I have. Can we actually put the numbers that are, under 120 over 80 and list them as normal? And then 120 over 80, we break down the ranges from there. Now, granted, everyone's baseline is different, right? Especially if you're on blood pressure medications and things like that. Everyone baseline blood pressure is different. So a person baseline may be 128 over 80. And that's just how they run, right? That's normal for them. However, when we talk about the general rule or rule of thumb for blood pressure and the therapeutic safety guide or ranges, that's what we want to, where we want to be. I'm not trying to get into that because that's a little bit different, but I think there needs to be a different way of communicating that normal range for blood pressure. Yep. Even if we want to start from the very early part of normal, because I mean, less than 120 over 80, that could be 80 over 60. Now we know that's not therapeutic and that's not safe, but that's less than 120 over 80. So again, there needs to be, like the new guidelines specify the ranges for elevated, the ranges for stage 1, the ranges for stage 2. There needs to be ranges notated for normal blood pressure. And that's all I got to say. Thank you so much for listening. This is from Coach LT, and I hope you found this informational, motivating, and helpful. Thanks.